What's important to know in terms of post-deployment pain is that patients are coming back with a number of key problems that are also impacting their pain in their lives. So many patients are coming back with not only chronic pain, but post-traumatic stress disorder. They are coming back with traumatic brain injuries, which are related to either direct trauma or exposure to IEDs, improvised explosive devices. They're also coming back with substance misuse problems that may be related to alcohol, opiate medications, benzodiazepine medicines, or illicit substances. And all of those not only impact the patient, but also impact the family. So that this is not just about caring for one individual, but looking at the totality of the impact for the family and the community as well. It's also important to note that only 50% of patients coming back or post-combat veterans coming back ever step foot in the VA. So that 50% of our combat veterans who do come back are exclusively seen in the private sector. In addition, of the veterans who come back that are seen in the VA, many of them also receive care in the private sector. So that this is not just a problem related to VA employees, VA providers. This is a medical problem with comorbidities that will impact all providers of health care wherever they may be. The important thing to note is, although these are complex comorbidities, when you address them as such and you take care of all the problems and not just one, these patients respond incredibly well to treatment and frequently will require not only an individual provider, but once again a whole team. It may involve just the VA, it may involve just an outside provider, or a combination of both. So we want to make sure that a dialogue begins and continues between VA providers and non-VA providers as well. In addition, as we talked about the family, 100% of the family members are seen for their primary care services and their pain services outside of the VA. And so it's important to understand what the impact of deployment is on the entire family, including children. What's important to know is we are talking about many comorbidities. So in terms of the question of when to refer for post-traumatic stress disorder, frequently that does not exist alone. There are patients who have post-traumatic stress disorder who also have chronic pain, who also have substance use problems, who also have a traumatic brain injury. And if you are a provider who understands post-traumatic stress disorder completely, but doesn't perhaps understand what may happen with that and a TBI or substance use disorder or chronic pain, it's important to get other people involved in care early on so that each is addressed simultaneously by providers who are working together. Now, many providers don't really understand that the VA welcomes co-management of these patients. And so if you're a provider who's not within the VA, frequently just getting that patient referred to the VA to understand what services available are there can solve many problems or begin the process of accessing specialists who understand the complexity of the problems. For many providers in the VA, we are so trained about understanding the complexity of the problem. Many of our clinics are set up with an approach that includes multiple providers. So, for example, our post-deployment clinics frequently have primary care, mental health, traumatic brain specialists all in one place. In our primary care clinics, we have easy access to mental health specialists, substance use disorder specialists, traumatic brain injury specialists. Even if it's not in the same location, we have easy access to them within our facility. So frequently, if you see multiple problems, one of which is not in your area of expertise, it's always helpful to get another approach or a simultaneous approach from a specialist, as long as that care is coordinated and all the specialists are working together.